Hello, it's Mark Chris from Memorial Sloan Kettering. I'm here today to comment on a very interesting piece in the current paper version of the Journal of Clinical Oncology. And the article is entitled, "You're Cured Till You're Not. Should Disease-Free Survival Be Used as a Regulatory Clinical Endpoint for the Adjuvant Therapy of Cancer?" Dr. Sobrero and colleagues, I think, have written a very interesting article and one that really hits home as to what the true issues are. The first thing they do is they make a fundamental difference of goals of care and realistic objectives of patients receiving therapy for metastatic, generally not curable cancers versus adjuvant therapy, curable cancers. And they make the point that from a patient's standpoint, when you rank the important things to them, number one is the chance for cure. Number two is the time free of cancer, ostensibly in normal life, for as long as possible, what we generally call DFS or EFS. And lastly, overall survival. There is so much discussion in the adjuvant world about not making treatment decisions based on anything but overall survival. And I think what that discussion does is it overlooks what the concerns of patients are and loses sight that cure and the chance for cure is the most important issue to them. And the surrogate we have for cure is disease-free survival. As those of you that have heard me speak on this topic before know, I say that if you fall off that disease-free survival curve in an adjuvant trial, you cannot be cured. And that's the issue. Keep people on that curve and keep people on that for as long as possible. The discussion that has gone on in oncology meetings, oncology forums all over the world is this focus of overall survival versus disease-free survival. But truly, it's a different story when it comes to the adjuvant or the neoadjuvant setting. And the conclusion of the authors in this article, Sobrero and his colleagues, is that in the adjuvant and neoadjuvant setting, disease-free survival is the primary variable. And I totally agree with that. And it's something I've been saying for a long time. The other corollary of this is where cure is a realistic goal of therapy. And I would put it to you that where you are considering patients for adjuvant or neoadjuvant therapy in lung cancers, that is the case. There is a different metric and trade-off between toxicity and benefit. I think patients are much more willing to consider more rigorous therapies, more difficult therapies, if indeed there is a chance for cure. And again, by cure, I mean, getting back to a normal life and a life free from cancer presence and free from cancer recurrence. So in addition to it being trying to meet the number one goal of patients, and that is to be cured, it's a different consideration when balancing adverse events and side effects versus the chance of cure. So my congratulations for Dr. Sobrero and his colleagues. Congratulations actually to the editors of JTO for putting this out there. Not JTO, I'm sorry, JCO, the Journal of Clinical Oncology. It is not something that people talk about much, but I think it deserves a lot more talk. And please, if you have any doubts, what I'm saying is not correct, just talk to a patient in this setting where there is the chance for cure. It's a very, very different talk and different discussion than you would have when there really isn't a very likely chance of cure. Thank you, Dr. Sobrero and your colleagues. And again, thank you to the editors of the Journal of Clinical Oncology for putting this out there.